Hi and welcome to my video on post-traumatic stress disorder, also known as PTSD. My name is Luke McDonald, and what I wanted to share with you in this video is some insight and some information into the different treatments and therapies that are used for PTSD and psychological trauma. Now obviously there's medication, and most medications used for PTSD are anti-anxiety medications. But I'm not going to go into medications here because this video is about psychological treatments that are available. And some of those are cognitive behavioural therapy, there's EMDR, also known as EMIs, music therapy, brief therapy, and image therapy. So I just want to give you a little bit of information about them. Now, CBT is it's become psychology's counselling style of choice, I guess, and to simplify CBT, you could say that what you think creates your reality. So it's all about the thoughts and the beliefs and the thoughts behind our beliefs. And although CBT is considered a new therapy, there's really nothing new about it. Buddha in the year 500 BC has been quoted as saying, "With our thoughts we create our world." So virtually the same thing as CBT sort of underpinning philosophy. So what really Aaron Beck, who's the main guy who is regarded as the developer of CBT, what he's done is he's taken the philosophy of Buddhism and he's put a therapeutic framework around it. Now, for mild cases of anxiety and depression, a couple of months of CBT counselling has proven to be effective. However, with more severe and complex disorders, CBT is considered by many to be a waste of time. And one of the main reasons for this is because of a part of the brain called the amygdala. Now, the discovery of the function of the amygdala, it's possibly the most important breakthrough that we've had in understanding PTSD and how to get over it. And I'll tell you where you can get some more information about that later. Now, another therapy that's become quite popular recently in PTSD is known as EMDR, also known as EMI, eye movement integration. Now, this is what we call it an exposure therapy, and it uses certain eye movements and sounds in order to desensitize certain triggers or certain memories. It contains 4 different phases of therapy, and studies have shown this treatment to be faster and more effective than CBT. There's a few different suggestions out there that attempt to explain how and why this approach can be effective for some. One being that it integrates the left brain and the right brain hemispheres, allowing different perspectives to naturally occur. So it's quite effective. And I'm sure you'll be interested about the information that I present to you later that goes in and explains a bit more about how that works. Another one that's not used as often today is image therapy. And what that's about is it tries to reduce any of the threatening or frightening mental images so that you can imagine images or mental movies without the fear or anxiety there. And there's really lots of ways to do this. It's very simple, it's easy to use, and unfortunately it's been ignored for a long time. So it's good to see that it's starting to be used a little bit more. There's music therapy, and that's being used a lot more widely now because it's just got more of a base of clinical evidence proving its effectiveness. I wouldn't consider it a brief therapy, but it has proven to be effective in managing lots of different emotional challenges. It's a gentle approach, but it needs to be used in conjunction with something else. It's not really a standalone approach. Another intervention or treatment you might hear of is brief intervention. And it's not really used a lot in PTSD because it's just not an appropriate approach for trauma. It's best used as it was developed for the field of addictions. So that gives you an outline of a couple of approaches that are available. And there are some newer and some even more effective treatments or approaches or therapies, whatever words you want to use, that have just become available. And I've got a couple of reports that go into more detail about these newer treatments. And if you are interested in getting these reports, well, I'm giving them away for free at the moment. And all you need to do to get these reports is to just go now to www.posttraumatic-stress-disorder.com. So just go there and pick up your free reports. They'll also explain everything you need to know about the amygdala in relation to PTSD, and that the information there is fascinating. It's something. It is a real breakthrough for psychological trauma and PTSD, and it's something that if you or someone you love is involved in PTSD, then you need to understand how that works. So go and get these reports if you want to know about these new discoveries in PTSD, as well as the simple mechanics behind how they work. So thanks for watching my video, and I hope you enjoy your free reports.